both operations and managing operations and managing resources in healthcare settings, just to ensure you have efficiency and effective service delivery in your healthcare system. I believe most have also touched on the responsibilities of a healthcare administrator. And I know most of us on this program, you're on this program because you want to become a healthcare administrator. What is expected of you as a healthcare administrator? One of the major responsibilities of a healthcare administrator is planning, strategic planning, which involves assessing healthcare needs of organizations or communities, looking at areas of improvement and strategy formulation on improving healthcare. The second area of responsibility if you're a healthcare administrator is in the area of financial management. Healthcare administrators must have some level of understanding in financial management as it concerns the healthcare sector and systems. It includes managing the financial aspects of our organizations, whichever organization you find yourself as a health administrator. Financial management aspect, you manage the finances, which includes areas like budgeting. I wouldn't know how much experience those in this class would have. Budgeting, accounting, financial reporting is also required in financial management aspects covered by the healthcare administrator. The healthcare administrator is to ensure that resources are properly allocated, for different segments of spendings that will be carried out, in the facility. It's also expected of a healthcare administrator to monitor expenditures, and work towards a holistic financial improvement. So that's also financial aspect of healthcare management. Also, in healthcare management or administration, you also have aspects that covers human resources. Human resources, like I mentioned earlier, the healthcare administration is about the leadership roles held in hospitals, medical facilities, and insurance companies that cover healthcare. Okay, so human resource management is also a key aspect that the healthcare administrator covers, which ranges from recruitment, managing professionals working in your system, and also managing your support staff in the system where you've been taken to work. Other responsibilities of the healthcare administrator includes policy and compliance. In fact, a healthcare administrator must understand TQM, which is total quality management. You must understand this. In total quality management, you ensure you stay up to date with healthcare policies, healthcare regulations, healthcare laws as enacted by the government, whatever state or federal government or Ministry of Health, where you could find yourself. So keeping yourself up to date is part of your responsibility as a healthcare administrator, okay? And why must you keep yourself up to date? You keep yourself up to date to ensure you're able to help your organization comply with the policies, okay? So you also keep yourself up to date with policies and compliance, because part of your responsibility is to take the policies, come back to your organization and develop them into an in-house practicable healthcare policy, and also supervising the implementation in-house, okay? And the reason for this is that there are ethical standards that is expected of you as a healthcare administrator to maintain in your organization. You also have roles and responsibilities like understanding information management. I believe must have touched a number of these things, but I just want to do a rough and brief summary of everything. Information management, as part of the responsibility of a healthcare administrator, has to do with overseeing the collection, analysis, and utilization of data, just like in not just public health, but also in clinicals and entire health system. Collection and analysis of data is key, very key in the health systems. Why is it key? If you collect accurate data and you as healthcare administrator are able to analyze it properly, it will help you improve your services, and also even it will even reflect in your patient outcome and even efficiency in operations, whether clinic or a nursing home, wherever you could find yourself. Part of the information management exposure and responsibility required of you includes implementing and maintaining electronic health records. I know some are in Nigeria, some may be in other countries, but gradually issues of paper recording is being phased out, still in the information management. So understanding how to maintain, implement, and maintain electronic health records is very key for anyone that will be a healthcare administrator. Other responsibilities include coordinating care for patients. The healthcare administrator has a very key responsibility. Remember, healthcare administration is a profession. I can also call it a business. And in the business, your number one client in that business are your patients. And so a healthcare administrator must understand how to coordinate patient care, which ranges from coordinating all the different departments that will see to the care of that patient. So it is key. It also covers collaborating with other medical professionals, to ensure that the service that that patient has come for, is paying for, is being delivered optimally. Also, in this line, in patient care coordination, it covers monitoring of patient satisfaction, getting feedback. Feedback is very key for healthcare administrators. So the feedback point is key. Please, let's take note of that. In healthcare administration, feedback is key because if the service you have delivered does not satisfy the patient or those concerned, then you're actually losing business and not fulfilling your mandate as a healthcare administrator. Other areas you will need to also touch as your responsibility includes community relations. Community relations is one of the responsibility of a healthcare administrator. I've had to run that as part of my assignment in the number of years I've served in the public health sector in relating with communities. I've actually worked with the USAID in the past, and I was their representative for certain projects that we had. And part of my responsibility that I carried out was relating with the communities. The project I carried out was for women in northern Nigeria. So we had to interact with traditional leaders, interact with communities where we needed to get this data from. So part of your assignment as a healthcare administrator is understanding and maintaining good relationship, not only with the patient, but also with the patient's family and with community leaders and other stakeholders. If there's any one of us that have worked on an international project, you will take note that in this healthcare administration, you have a large pool of stakeholders that you deal with, ranging from the state government, to donor agencies, depending on the project you find yourself, state government, donor agencies, and other professional bodies support this. So you must, as a healthcare administrator, understand how to relate well with these different groups on behalf of the organization where you work. And part of the community relation also covers participating in health education campaigns. I personally have undertaken health education campaigns. At a point in the past, I worked with UNICEF, HIV project, and those were part of our assignments. We had to penetrate communities at that time, HIV was still emerging, and communities were not very receptive to discussions on public health issues as it related to HIV. Okay, so we had to look for ways to blend our health campaigns to tally with belief systems of those communities we're taking our information to. So it's also part of your responsibility in your community relations to come up with public health initiatives that can help your service delivery to whatever community you are delivering your service. Okay, what are the different aspects of healthcare services where a healthcare administrator can deliver his or her service? I believe a number of us here are health practitioners, but for the sake of those that are not, different aspects of the healthcare services cover primary care. So healthcare administrators can work in areas of primary care, which has to do with general health services like routine checkups, vaccination, treatment of illnesses and injuries, and the rest. So as an administrator, you can find yourself working in a primary care system. You could also find yourself coordinating in specialty care systems. That's where you work with other medical specialists. Okay, you can also find yourself working in emergency care systems. In certain nations of the world, some nations of the world have very strong emergency care systems, like the paramedics and all that. The healthcare administrator can also work under such systems. Emergency care systems can also work under a direct clinic where in-house inpatient care is being provided. Different aspects of healthcare systems, rehabilitation and therapy, prevention care, diagnostic services. There are no limits to where a healthcare administrator can fix him or herself. You can fix yourself in health information technology, which is one of the emerging fields in the healthcare administration sector entirely. Where you do electronic health record keeping. We actually have different digital tools that we engage to improve healthcare. In public health, we have quite a number of them. So health information technology and systems is another area where healthcare administrators can actually function optimally. Okay. Aspects of home health care, mental health services, palliative and end of life. There are lots of areas where you can actually function. So it's to check out the one that concerns you and fix yourself in. So in summary, career opportunities and places where you can work in hospitals and clinics, can work in nursing homes. In Nigeria, issue of nursing homes, we just have a few nursing homes in Nigeria, but in a number of developed nations, we have quite a number of nursing homes. You can work in public health departments, either a local public health department or state public health departments. You can work with government agencies. There are various government agencies. For example, I am speaking from Nigeria, in a number of government agencies that require healthcare administrators, where you can actually get to work. You can also work with insurance companies that oversee health management will be a very good place where healthcare administrators can also work. I think I was given a very short time to do my brief summary, so I think I will just stop here and hand over to the anchor. Thank you very much.
Yes, Mr. George, I just feel as if we should just allow you to keep going, just keep going on and on and on and on, you know? For anybody that is not on this program, I think the person just missed out big time. One thing I've come to realize in Nigeria today is that it's not as if there are no jobs. There are jobs everywhere, but people are not primed for those jobs that are available. And that is exactly what we are trying to sort out here. There's no doubt that after listening to Mr. George Obi, there's no iota of doubt in my mind today that you listening to him, we know that, yes, you actually have a place to work. But the question is that, do you have the training, the competence, experience, and skill to work in that place? And that is what we are trying to do. Now you know about healthcare administration. The next thing Mr. George is going to tell us is probably how to get into the profession of healthcare administration. I can see if it is hot 10T. Both of you are using your phone or your laptop. Yeah? You're enjoying the program together. That's nice. Okay, Mr. George, just in 5 minutes, just tell us how you can go into the healthcare profession, healthcare administration as a career, and just 5 minutes. And the stages we can get to from where you can start with SchoolSat. Can you join as a SchoolSat holder, a diploma holder? What kind of qualifications do you need? This kind of training, can you start thinking of joining any other association or group or getting other further qualification to get into the healthcare profession and all that? What to you, Mr. George?
Oh, thank you, Doctor. Thank you. The healthcare administration sector is actually a very open sector. Even though if you have a medical background, it gives you an advantage, but anyone can get into this sector. For those who have moved out of the country, out of Africa, will bear me witness that even though they are not of the medical background, they're able to get into healthcare administration, because there are many aspects of healthcare administration that is not limited to pure medicine, clinicals, or epidemiology. Okay, so it depends on the level, because healthcare administration is a form of management and leadership cadre. It is not limited to medical personnel. However, a minimum level of education, depending on the level you are going to be operating in or with. For example, the healthcare administration gives room to those from fields that concerns human resource management, give rooms for those who have some knowledge in the aspect of IT because of information management and maintaining of health systems as per health information technology and records. Most of our hospitals, when you get there presently, you discover that for a doctor to attend to you, they no longer carry paper files. From the reception where you will be received, which is the administrative desk, the moment you give them your name or your file number, your file is electronically sent. So that's not medicine, that's technology. So if you have some knowledge in the area of technology, you can get into the healthcare administration sector. You also have knowledge, ability to do public speaking, because part of healthcare administration covers health education and health campaigns. There are lots of opportunities, especially for those that are not medical people, in the area of health education and campaigns. There are so many health areas and issues that require campaign. For example, from aspects of communicable diseases to aspects of non-communicable diseases, things like HIV. Like in Nigeria presently, in Kaduna and Kano State, there's an outbreak of diphtheria at the moment. And a lot of Nigerians, for example, don't know much about this. A healthcare administrator can smoothly lock him or herself in the area of health education, which anyone can do. Once you have the relevant training like what you are receiving now, you can actually slot yourself. For example, the projects where I've worked, I've had colleagues. I am of the medical profession, but I've had colleagues that are not of the medical profession and doing excellently well in the aspect of health campaigns and education. We can also have people from financial fields come into the healthcare administration. Things like budgeting, financial reporting, expenditure monitoring, and all that. They are actually financial management, even though when you pass through a more detailed training, you also touch this financial aspect. But people from financial fields can actually, fields in finance, economics, mathematics, accounting, business administration, can actually also come into healthcare administration. So it's actually very, very open. The first step to getting in is going through a training like this to understand what it is. Okay, sorry, I can see people commenting that they cannot hear. Please, can we all hear me? Can you hear well?
Yes, if you
Can we hear me well?
type yes. If you can hear, just type yes. So I think most people have issues with their audio. They should work on it. However, we're going to have the recorded session sent to them in a platform. So you can go ahead, Mr. George.
All right. Thank you very much. So the field of healthcare administration is actually very open to those that are willing to learn, those that see need. And I want to please take note of what I'm saying. For those interested in relocating to the West, say US, Canada, the UK, healthcare administration is a sector that will pay you well. It's also a sector that will ensure that you get employed early enough. A lot of times people relocate with different professions and discover that they keep scampering for jobs and don't get any. Healthcare administration is a field that gets you easily employable. Healthcare administration is a field that gets you easily employable in the West. So the field you are going through now will open you up to lots of opportunities. And like I've said, for example, those in Africa, we have lots of health projects running, those in the hospitals, those being run by agencies. And there are vacancies in a number of these places. Maybe after now, I will speak with Doctor and share a number of vacancies and career opportunities available. There are many. When I mean many, and I tell you the truth, this is a hidden and silent sector where lots of people are making very good living from, and so many people in Africa have not come to realize the strength of this field. So I want to encourage you, you're part of this course, make good use of it. Get, there are opportunities, search them out, and get into the field. There are so many opportunities. Thank you very much, sir. I would do well to forward some of the career opportunities in Nigeria and some internationally to you, some of the vacancies, international organizations in Nigeria and other countries in West Africa taking people. There are even exchange programs for this healthcare administration. There's this organization called VSO, Volunteer Services Overseas. There are opportunities, sir. There are a lot of opportunities both here and abroad. Okay, thank you very much.
Thank you so much, Mr. George. Each time you speak, I just feel like allowing you to go ahead. But we have time constraints here, and we have a limitation as to the time we can spend here. We have just 14 minutes more to spend. However, I want to believe that you've touched almost every sector that anybody will want to talk about. And you've talked about healthcare administration in such a plain and simple language that anyone, anybody listening to you will understand and get a full picture of what healthcare administration is all about. You've also talked about the other part that is so interesting and the fact that there are opportunities out there. Well, one of the cardinal aims of LaPlage is to ensure that people start seeing opportunities from the angle they used to see it from. So if you studied English or maybe sociology or whatever, for instance, now you know you can go into healthcare administration. You don't need to keep writing applications for sociology jobs and jobs that have to do with sociology or English language and say there are no jobs. There are jobs. Just go into the other professions that all you just need to do is just have a training like this, have the awareness. And let me shock you, most employers don't give a damn about where you are coming from anymore. They just want to know that you have the knowledge, the skill, the competence, the expertise. And with somebody like Mr. George talking to you, I'm sure you already see yourself as a healthcare administrator. So ladies and gentlemen, I want to believe that we are so happy, we are so excited about this program. We are just going to take just 5 questions. 5 questions. Each question should just be in 30 seconds. Please, you don't need to explain your question. Once you just ask the question, we will perfectly understand what you're asking. I just need 5 hands raised so that I can ask question. And please, you don't need to go about asking questions that have been answered by Mr. George. We are going to, by virtue of this training, you are going to be an automatic member of, added to the Association of Healthcare, African Society for Healthcare Professionals. You're going to be there. And while you are there, we'll be inviting Mr. George. He's just hearing this for the first time. We'll be inviting him and other professionals to come and talk to our members. Career opportunities for our members, opportunities for people that want to travel abroad, what they can do. We don't help people to travel abroad. We don't do that. We don't go into all that jackpot stuff and all that. But we help you to know that if you are abroad, these are the things you need to know. The black and white you need to know. Don't just go there blindly because you've got to see COS. So Mr. George will be talking to us as an experienced person. Other professionals will be talking to us. It's going to be a free program for our members. So please just watch out and don't bother yourself much if you are not able to have time to talk in this program. Just make sure you join ASHP. Thank you. So Henry Oviasogie, please straight to your question.
Okay, thank you very much, sir. Just very straight. I have a master's in healthcare administration, and I took this course as a refresher. And I want to say you guys did an intensive job.
Thank you.
You know, you did a thorough job.
Thank you.
Both in the lecture and in the presentation.
Thank you.
You know, and I want to commend your effort. You did a lot. You covered a lot of grounds. What I did for 18 months, you guys did it for a very, very short period.
Thank you.
So I want to commend your effort.
Thank you.
Quickly want to chip in that healthcare administration is just management. Like you said, anybody can go in. It's just like MBA. When you are getting your MBA, anybody can get into MBA. And healthcare administration is part of MBA. If you are doing MBA, it's an option too, you know. And my advice that you have to learn statistics because you have to be able to understand your spreadsheet, how to use Excel. So you should basic stack just for budgeting, like he said, financing, budgeting, and all. So you should be able to know a little statistics and be able to use some computer program like Excel spreadsheet. You know, then he said again, the patient is your number one. But again, I want to draw him back that your employees are your number one. You know, employee satisfaction is very, very important. As an administrator, you have to take care of those working under you. And when you satisfy them, that they will be able to satisfy your patient. You know, so let me not take time. I think you guys did a great and fantastic job.
Thank you very much.
It was wonderful.
Thank you.
Thank you.
Yeah, I appreciate.
Thank you.
Yeah.
Thank you.
Okay, that was a confirmatory statement from Mr. Henry Oviaso-Gie, and he has said it all. May I inform everybody here that we have students from Ghana, Cameroon, several other countries. It's not just a Nigerian program, and you need to understand that this is an international program, solving problems psychologically and otherwise, and creating solutions for people. Let me take a second question. If it's Sunday, your video is not on. Please, your question, please. If it's Sunday.
Good evening.
Yeah.
Thank you so much for this program. Really appreciate it. So I'm a medical doctor and I'm thinking of doing a master's in healthcare management. Do you have any, do you think should I go for the master's, or do you think just having some other certifications is enough for me to switch into the healthcare management, or also doing a master's is beneficial? What do you think?
Yeah, Mr. Henry. Okay, I say Mr. Henry, Mr. George. Mr. George, over to you.
Okay. It depends. Okay, sorry. Let me get the camera back on. Okay. It depends on the area you would want to specialize. There are aspects in healthcare administration that are general. There are aspects that are specific. So if your target in healthcare administration are the specific aspects, then, and if you can afford the master's, go for it. But if it is general, you wouldn't need a master's. You can, especially since you are of the medical line, you can go ahead and apply with your medical certificate. You'll be able to get a good job with what you have in your hand. Thank you.
Thank you, Mr. George. Yes, I want to believe that the question was properly answered. And yeah, Kahata Lumbala.
Yeah, good evening, Doc.
Good evening.
Okay, yeah, so I'm a public health specialist based in Zambia, southern part of Zambia, specifically Choma. Yeah, mine actually is just a request. I wanted to request that probably we can come up with a group in line with the program that we've done, so that whenever there are these vacancies or job opportunities, we should be able to be sharing those groups. Thank you.
Okay, thank you. Like I mentioned, we have African Society for Healthcare Professionals. Every single person here is free to join, and we'll be sharing vacancies. And Mr. George has also volunteered to send out vacancies that are existing. And if you have been with us, you understand that from time to time, we used to share out vacancies from directly verified on a UN site. And we have so much. You just need to put in your own time too, to create time to follow us and follow what is happening. Yeah, and also encourage others to do. Thank you very much from Zambia. Pastor Mary Adewale, I need to call you so that you can pray for us. Over to you, Pastor Mary Adewale. You can unmute yourself, man.
Thank you. Good evening, all.
Good evening.
I want to appreciate you for all the classroom teachings and the Zoom we had today, and including this one, because this aspect is my own area of specialization as well.
Thank you.
And when he was teaching, he made mention of health information technology, and that aspect is very crucial because most hospitals now are using e-medical. But the only aspect I want to also ask from the facilitator or the one who gave us the lecture is that when you're doing the general, because what I'm doing now is general health administration, though I have health people that are into health information technology as my part of my team. And if we've had some challenges, the only thing is that since I'm computer literate as well, so whenever those challenges come, I know how to go about it as well. But I still need the expertise. Now, if you're not, I did not major in information technology, but I have an idea. Is there any program that one who is not a major in it can just do just like we did, so that you can have deep understanding of how to manage the system? Because there are times that it will just, your information will, it will crash, the system will crash. If you don't have a good backup, you're in trouble. And even if you have a good backup, when you bring them back, it takes you time to start doing one thing or the other to get your data reinstalled and all that. But if one is a specialist in it, you know, where you're working with a team and you're not very much conversant with what they are doing, there's essence of one, you know, playing around. But if you're there, you know what you're doing. You know that, yes, whether they're there or not.
Madam, we need to know the question you want to ask so that Mr. George can go straight to the question and sort it out.
In the area of health information technology,
yeah,
you know, we have done policing, we have done community policing, we have done chaplaincy and some others. I'm asking if there's going to be anyone on this health information technology. We've done it in this program.
I can assure you that is coming up soon. You know, the issue is that because of the system we are running, by January next year, you can just come to our site, take a course in any of these areas, and get a certificate. And for the Zoom, for the WhatsApp and Zoom session, we just have to accommodate everybody within the time we have. I know we cannot have more than one class at a time. So by God's grace, between now and January, these courses are going to come up. They are very, very important. Even data analysis is going to come up. So these are very important courses that will come up. Thank you very much.
Thank you very much. Thank you, sir.
Drisberg Bonnie. Are you there? Okay, let's move on to somebody else. We'll just take one more question or two more questions, one male, one female, and that's all. Margaret Agbolaho.
Okay, good evening, sir. Straight to my question. I have a BSc in accounting, and from what Dr. has already answered, I want to be certain that is this certification enough for us to be able to get into the healthcare administration kind of jobs, or we need some additional qualification or something?
Yeah, I think Mr. George talked about that. It depends on the level you are coming in from and your background. But what you need to understand is that one thing we all need to understand is that, first of all, you need a background entry point, which you just got in with this certificate. I made mention of the fact that we have people working abroad with our certificates, but we don't also advertise our courses based on the fact that you're going to get a job abroad. However, anybody that needs any healthcare administrator, probably in the accounting section or in the finance section of the healthcare administrative unit in an organization, we definitely go for an accountant that has a training in healthcare administration. We go for an accountant that has some level of exposure to healthcare administration. So if you're an accountant, I'm an accountant, I've never done anything like healthcare administration, and you've done one, you have an advantage over me. But that is not to say that you cannot go for further courses in healthcare administration. I think it's a very simple approach to going into the healthcare administrative, whatever. Just like Mr. George just told you, with this certificate, with this exposure, with this knowledge, you have stand a chance over and above others that don't even have any form of training whatsoever. So, but that doesn't mean that you can't do other courses. You have to go to other courses, higher courses. You can even do masters. You can go on and on and on. I don't know if I've answered your question, madam. Yeah, okay, excellent. So one more, please. I think we have to get a male to ask his question so that you don't get accused of gender, whatever. Okay, Uzezi Akpotu. Please, you have only 30 seconds to ask your question. Okay.
Yeah, okay. Yes, good evening. I'm here. Thank you so much for this opportunity.
Okay.
Yes. I'm a medical doctor, right? And well, thank you, because I've had to take several courses, on your program. It has helped to really boost my CV a lot.
Thank you.
And I've helped friends to get these courses too.
Thank you.
And they're doing well. Someone is actually working now as an healthcare administrator of a state-of-the-art facility, courtesy of these programs that I've helped him to get from your system. So I can testify to that.
Thank you.
Yes. And it's paid in 7 digits, no doubt, no jokes.
Wow.
Yeah. Yes. Yes. So what I want to ask is this. What I want to ask is this. Now, yes, healthcare administrator. Now you're an healthcare administrator, right? You want to take a career path, right? Mm-hmm. Is there apart from the part of being an healthcare administrator, of course, for any government, any facility or what have you, is there a pathway that can take you to a pinnacle in that line of an healthcare administrator? I don't mean just jumbling things up. I mean a career path on the line of an healthcare administrator to a pinnacle. Thank you.
Okay. That's a very straightforward question. Over to you, Mr. George. Over to you, Mr. George. Are you there? Mr. George.
Sorry, please.
Okay.
Sorry.
Welcome back.
Sorry, can we get this question again?
Yeah, he is asking for a career path from point 0 to the highest point as a healthcare administrator, no matter your background or whatever. Is there a career path that you can move step by step to the highest point? Just like in the army, you get to become
Of course, there are, every field has its level. It's just that the healthcare administration is actually a management level, even though it's in different levels depending on where you're coming in from. You can rise in healthcare administration to also becoming a consultant. Just as you have different fields in the medical line where you study just medicine, rise, become a specialist and all that. Yes, there are areas of specialization. Now, these areas of specialization also follow the various career paths we have mentioned. For example, there are areas of specialization in information management, the health information systems that we have mentioned. You can rise in information management and health information systems. So depending on the aspects, the financial management aspect, you can also rise. So depending on whichever field you have chosen in healthcare administration, you can rise the cadre there to becoming a specialist at that. Now, operating as a specialist also depends on the program or the facility where you have found yourself, because it is not every facility that requires the services of certain levels of consultants or professionals in healthcare administration. So that's also a factor to consider. Thank you.
Yes, thank you, Mr. George. And I want to believe that Mr. Uzezi Akpotu, your question was well answered or responded to. However, like I said, we have an association that we encourage everybody to join. They will be sharing vacancies, opportunities, even opportunities abroad. However, please take note, We don't process visas for anybody. We don't do papers for anybody to travel abroad. We just make sure we provide you with the best information that is available, whether from the UN, whether from individuals or organizations. And the judge has also volunteered to send out vacancies from relevant bodies. And once you join this association, it will be easier for us to share this on a platform that everybody can see, because we can't be attending to everybody one after the other. And tonight, some persons will start getting certificates tonight. Others, majorly, others will be tomorrow. So please, no pressure, just relax. By Wednesday, by God's grace, everybody should get their certificate and it will close. So if you have not made your payment for your certificate, you have between now and Wednesday to do so, but I advise you to do so as soon as possible. Yeah, and is there any other thing? I don't think there's another thing we need to know. This program is going to be recorded and sent to your class to watch. For those of you that must have missed, and if you have friends in your class that are not here, tell them to relax, that they're going to get the recorded video to watch. Thank you. God bless you all. I appreciate you all. I want to tell you that just be positive. There are huge opportunities there. There are jobs everywhere. Don't wait for anybody to tell you there are no jobs. There are jobs. And by God's grace, our duty here in Laplace Metaverse is to expose you to all those things you need to know to give you further opportunities to spread out from what your traditional background, no matter what you study. God bless you and see you in the class again. Thank you and good night, everybody.
Good night, sir. Thank you very much.
Good night.
Good night, sir.
Thank you.
Thank you.